All right, so let's finish the discussion on social stratification and poverty by taking a look at some of the actual consequences of poverty. So what actually happens as a result of poverty in the United States, who gets impacted, how can we connect this to some current events and some broader social issues that we'll be discussing throughout the remainder of the semester, and then also wrapping up again by discussing some potential solutions to poverty, especially comparing the United States to other nations who have lower poverty rates, and hopefully thinking about some meaningful ways that we can actually address poverty both as individuals and at the larger structural level in the United States. So just take a second here and take a look at this graph. This is showing household income on the x-axis here, then the y-axis, the vertical axis, is showing the expected age of death for people in the United States. And you'll see there's two different lines on this graph here. The blue line here represents the life expectancy for people of various incomes for men, and this red line here represents the life expectancies for people of various incomes who are women. So you can see here, breaking people again into kind of like the 5 social classes that we talked about. The poorest 20% life expectancies are shown in this range here. The next poorest 20% of people, so between the 20 and 40 percentiles, life expectancies here, and so on and so forth. So what you're seeing here is 2 important things. First is that the richer a person becomes, so the further right we move on this particular chart here, the longer the life expectancy becomes for people. And this is true for both women and men, right? You can see here that, again, the women are the red dots on this particular graph. The men are the blue dots. And the wealthier the people become, so the higher social class people have, the longer their life expectancy lives. In fact, not only do wealthier people have longer life expectancies, if what we're seeing from this graph here is that the richest American men, right, so the richest American men, those that are closer to the 100th percentile, the wealthiest men in the United States, live 15 years longer in comparison to the poorest men, right? So if we see this down here, poor men in the United States, if we look at this bottom 20 percentile here, looks to have about an average life expectancy around 75 years of age, whereas the wealthiest men in the United States here have average life expectancies closer to 90 years, about 87 years. And then we see the same gap, although not quite as drastic for women, right? The richest women in America live 10 years longer than the poorest women. So we see the average life expectancy for the poorest women in America looks to be around 81 years of age maybe. For the richest women in America, life expectancy increases up to almost 90 years, right? Closer to 88 or 89 years of age. So this becomes increasingly important as we can see that obviously what this graph represents is that a person's social class, their socioeconomic standing, has a significant impact on their life expectancy. So we can make the argument using this data that a person's socioeconomic status predicts their health in a lot of ways. So let's look at some more specific ways that a person's socioeconomic status is connected to their health and their life expectancy. Well, many low-income Americans live in places that are referred to as food deserts. A food desert refers to a neighborhood that does not have easy access or affordable access to things like fresh foods, fruits and vegetables, etc. And as you can imagine, a lot of people that are living in poverty don't maybe have reliable transportation, so it doesn't mean they can drive 5 or 10 miles to the closest grocery store that has access to fresh foods and fruits and vegetables, things like that, at least affordable ones. So as a result, a lot of people living in poverty have to do the majority of their grocery shopping in things like convenience stores and corner markets, which predominantly only carry processed packaged foods. People living in poverty also often resort to eating fast food far more than people with higher socioeconomic statuses, because you can feed a family of 5 off the dollar menu at McDonald's for approximately $10 versus going to a restaurant where maybe you might have access to fresh lean proteins, healthy carbohydrates, fresh fruits and vegetables, where feeding a family of 5 could cost upwards of $100 in comparison. People in lower classes are also less likely to have health insurance. Obviously, in the United States, the main way people get health insurance is through their employers, but a number of jobs that pay people hourly, so things like in customer service, food industry, etc., very rarely offer health insurance to their employees. So if you don't have a salary job or a full-time job, you're less likely to have health insurance. And as a result, it's people specifically in lower socioeconomic statuses, people that are working those hourly positions that are less likely to have health insurance, which can obviously prevent people from seeking medical care for things like routine checkups, preventative screenings to prevent deaths from things like cancer and other preventable illnesses with routine care. So not having health insurance obviously impacts a person's life expectancy. And also, while Americans without a high school degree only account for 11.8% of the population, they account for over a quarter of the uninsured population in the United States. So again, we see this real pretty severe discrepancy here in terms of education being connected or used as kind of a proxy of socioeconomic status, and how that impacts the likelihood as to whether or not an individual will actually be able to afford insurance. This particular graph right here, or this map, is a picture of the different neighborhoods in the city of Chicago. And I include this here just so we can kind of look at how, again, socioeconomic status gets mapped onto a person's health and therefore their life expectancy. The south side of Chicago is notoriously known for having very high rates of poverty in comparison to the northern part of Chicago, especially the northeastern part of Chicago here, which is typically the wealthiest part of the city of Chicago. And what you see here is that in this wealthy part of Chicago, the majority of these neighborhoods are colored green, which indicates that they have an average life expectancy of between 78 to 84 years. And here on the south side, where the poorer cities in Chicago are located, are predominantly red and orange, which means they have life expectancies much lower, 67 years to 75 years of age. So we can also make some bigger connections beyond just looking at life expectancy and socioeconomic status here. Lower income families live in poor neighborhoods, which often have poor quality schools, which have higher expulsion rates and lower graduation rates. So if you live in a poor neighborhood, your kids are probably more likely to get kicked out of school or suspended, or they're more likely to drop out in comparison to living in a wealthier neighborhood. Students who drop out of school at young ages are more likely to resort to criminal activity in order to survive, increasing their likelihood of being arrested or murdered. All of these obviously can have a negative impact on an individual's overall health and life expectancy. And again, if we take a look at Chicago here, this time looking at 3 different maps that paint a very powerful story when we look at them collectively. So this map that has showing Chicago neighborhoods in different shades of green here is showing the property values of homes in Chicago. So what we can see is that the darker shaded neighborhoods here are actually those with the highest property values, and the lighter shaded areas here have the lowest property values. So again, we start to see this income disparity in the south side of Chicago, which again is predominantly poor working class families, especially in juxtaposition to the northeastern part of Chicago here, which is very darkly shaded, meaning that the property values are much higher. The quality of schools can almost be identically mapped onto the property values. And as we'll talk about later in this semester when we address education, the reasoning for this is that public schools are largely funded by property taxes paid in any given neighborhood or in any given school district. So if you live in a poor neighborhood, right, these light shaded green neighborhoods on the south side predominantly of Chicago, you have lower property taxes, which means your schools in that district have less funds, which results in poor quality schools here, right? We see that the lighter shades here, which represent the worst quality schools in Chicago, almost perfectly map onto the poor neighborhood in Chicago, the neighborhoods with the lowest property values. And identically, this northeastern part of Chicago, referred to as the Gold Coast, that has the highest property values, has the highest quality schools. Now, interestingly, we can also map crime rates onto this, right? Now, it's a reverse here. The darker areas, these darker blue shaded areas in Chicago have the highest crime rates. The light shaded areas have the lowest crime rates. So what we see here is that if you live in the poor area of Chicago here with low property values, you have worse quality schools for children and significantly higher rates of crime. Conversely, if you live in the wealthier, the dark green shaded areas with high property values in Chicago, your kids are more likely to go to much higher quality schools and you have significantly lower levels of crime. So all of these, right, starting with property values is being kind of used as this proxy for how we can measure socioeconomic status, really clearly shows us that these broader implications of being poor in the United States. If you live in a poor neighborhood, you're likely going to have poor schooling, which results in students dropping out or being expelled at higher rates, which results in young adults engaging in more criminal activity, which is what these maps of Chicago clearly indicate. So just to kind of summarize these kind of systemic issues that kind of strain out from poverty, in comparison to wealthy people, poor people experience more family problems, including higher divorce rates, more domestic violence. In comparison to wealthy people, poor people have far worse health on all different outcomes. We have higher infant mortality rates for poor people, meaning that babies that are born in poverty are more likely to die than babies that are born into wealthier families. Early adulthood mortality rates are higher for poor people, meaning they have lower life expectancies if you're poor. Poor people have worse mental health problems, and they're more likely to receive inadequate medical care. In comparison to wealthy people, poor people also receive inferior education. They attend less funded schools. They're less likely to graduate high school in comparison to wealthy people, and poor people are also less likely to go to college. All of this contributes to further inadequate housing. In comparison to wealthy people, obviously poor people are more likely to be homeless at some point in their lives. They're less likely to ever own a home, and they're more likely to live in areas that lack resources. And also, people who are poor end up being more likely to commit crime. If you think about this, if you're poor, living in a poor neighborhood with poorly funded schools, you end up getting kicked out or expelled of school, and now all of a sudden you don't have a high school degree, but you need to make money to support your family. What are you going to do? Well, maybe you have to resort to engaging in illegal activity, dealing drugs or something, a job that doesn't require any degree in order to support yourself and your loved ones. And we'll talk about this, the complexities and the connections between education and crime, more so toward the end of the semester. So let's wrap up by addressing some solutions to poverty. We haven't definitely painted a very happy picture of poverty in the US, especially looking at the unequal distribution of wealth. And this story gets even more sad if we compare the United States from a global perspective. The United States has the highest poverty rate amongst wealthy nations. The highest poverty rate. Look at this. In fact, our poverty rate is nearly double that of other industrialized wealthy nations in the world. So why might this be? Well, what sociologists largely agree is that these other nations that are also wealthy nations that have significantly lower poverty rates have recognized that poverty is a societal problem and not an individual problem. I think this quote from a recent study does a pretty good job kind of summarizing this argument. It says, such countries often invest heavily in both universal benefits, such as maternity leave, childcare, and medical care, and in promoting work among poor families. The United States, in comparison with other advanced nations, lacks national health insurance, provides less publicly supported housing, and spends less on job training and job creation. These other countries all take a more comprehensive government approach to combating poverty, and they assume that it is caused by economic and structural factors rather than bad behavior. So this is critically important here, recognizing that poverty is a societal problem, it's a structural problem, and if that we as a society would increase or pass more policies or put more policies in place to protect people at the structural level, for things like providing universal health insurance, free college education, job training for people and folks to kind of distribute wealth more equally, we could overcome poverty and as a result save our society billions of dollars that we are currently spending to combat the effects poverty have in the United States. So what can we specifically do? Well, we can, as individuals, participate in political protests and work on electing political officials into office who advocate for poor and are driven to get rid of poverty instead of thriving off of poverty. We can encourage local, state, and federal elected officials to support anti-poverty programs. We can support policies that have been proven to minimize poverty in other nations, including raising the minimum wage, providing universal health insurance, and increasing Pell Grants and financial aid for higher education. We can also use employment data to prove to our family and friends that it is inaccurate. It is a myth to think that poor people are lazy. And lastly, we can volunteer at local food pantries or homeless shelters. So these are just a number of things that we can, all of us, do as individuals in our society to help address this social issue of poverty. Of course, as we talked about, though, poverty being built into the social structure of the economy in the United States is built to endure the challenges of individuals, but collectively, if we all work, we can hopefully reduce poverty levels in the United States, borrow ideas from other nations that have been proven to reduce poverty, and more equally distribute wealth throughout the United States.